Hello. If you're in there, say hello. Say hello, say hi. Hello everyone, Adolescents Mental Health. How are you doing? Hello, hello. If you're in, say hello. I wonder why everybody is running away from adolescents' mental health because really, there are a lot of people running away from this topic. And I'm just trying to be an adolescent as much as possible today, wearing the long sleeve, covering up with the blanket, listening to music, being on the phone. Like, I don't even care what is going on in the world. I want everybody to just leave me alone. How are you doing? Say hi to me. Somebody says hi, Dayo, but I don't know the name. Let me find out. So, adolescents' mental health. This is a huge one. This is one that it needs a village to come and address this issue because adolescents need our support. So please, this is going to be as interactive as possible. So let's just start by saying if you have an adolescent very close to you, you have a teenage daughter, teenage son, nephew, nieces, if you have an adolescent close to you, can you just give me a thumbs up or hello in the chat box? I want to know how many of us are really, really close to them. I do have a number of them. And I, well, for me, growing up, my own adolescent phase, I think that it was really turbulent. And a lot of people don't really understand. Well, I believe when people become parents, they don't understand what it felt like when they were adolescents. So it's it's kind of like what is wrong with them. But so if you have an adolescent close to you, especially if you are a parent of an adolescent, will you say hello in the chat box, in the comment box? And here is another question for you. Which of these two do you think is more stressful? Being an adult or being an adolescent? Which one do you think comes with a lot of stress? Plenty. Jezba. Okay. Plenty adolescents around you. Okay, good, good. Ah, uh, that stage is one very serious phase of life. So what are the stresses you think? What are the things that you think stress all these adolescents out? What do they go through? Or where did you go through as an adolescent? There are five major topics that we're going to pick that we'll talk about during this series, but I want it to be as interactive as possible. So I want to know if I'm thinking what you're thinking, or if you're thinking what I'm thinking. So, what are the things that stresses adolescent out? What makes it so stressful for them? What do you think? What do you think? Let me see. Adolescent, so what is like you're like it's is it the adolescent peer pressure? Thank you, Jezba. Peer pressure is huge on them. And this is the phase where they're even trying to know who they are. So in the developmental stages of life for everyone, the adolescent phase, that is when they have the identity versus role confusion. They are trying to really know who they are. And peer pressure is out. It's so real out there. There's a lot going on. You either fit in or you miss out. So as they're trying to stand out, as they're trying to be their person, they're also trying to fit in so that they fear that FOMO, the fear of missing out is there. So they're trying to comply, they're trying to be like them. At the same time, they're trying to find out who they are. And so if you're in, I see a number of people are watching. Tell me if you have an adolescent very close to you and tell me what do you think stresses them out? What are some of the stressors that adolescents go through? What are some of those stressors? It is not easy. So as I'm waiting for your responses, I'll tell you this. This is one conflicting phase of life. This is when you hear you are no longer a kid. You should know better than that. And then they also hear things like, wait, you are still in my house, I'm still feeding you, and you follow my rules. So they're like, okay, I'm no longer a child and I should take initiative and do stuff. But at the same time, I don't have that independence or that autonomy. And they're struggling between who am I really. Another problem or issue is they still want to have that parental security and be in the house, and they still want that safety. At the same time, they want to explore what is going on outside. So they're caught in between, okay, what do I really do? How do I balance this out? They want to be with friends more. They're trying to stay away from their parents. The parents are trying to protect them because this is a time they're very vulnerable. How do they balance things? I think a good question to ask is, how did you balance stuff? And if you're watching me right now, you're like, how did I balance stuff? No way. The world has changed. Everything is not the same anymore because right now, they have other things influencing what is going on with them. So at this phase, there's a lot of conflict going on. I'm seeing through that, but I'm really expecting I'm expecting Big Bamo, happy birthday in arrears. Thanks for showing up. Okay, so they're like, okay, which of these two do I need to do? And I'm waiting for your answers. How did you deal with it? What do you think they're going through? What are the conflicts? I really want us to engage today, and I want to know what you think. And I've heard that peer pressure is big. What about responsibilities at home? What are the things they now have to do? The expectations, the responsibilities that we have for them, that parents have for their children. I don't have an adolescent yet. The responsibilities that parents have for them. How about that? And then how about the school demand? What they have to do right now in school, the academic demands for adolescents they're huge. And they have a lot of things to do. They have so much to do, homework from school. They get to the home and there's also so much to do. And we're wondering, how do they balance this? Well, here are the things I want to say. The top mental health issues or the mental health concerns for adolescents, I picked 5 and I struggled to pick 5 and I still even had to merge them together somehow. I have mood disorders, anxiety disorders, eating disorders, substance misuse, and I struggled with attention deficit disorder and oppositional deviant disorder. All those things, they come into play. But I'm like, how do we talk about adolescent mental health without talking about suicide? How do we talk about adolescent mental health and not talk about the self-esteem issues? How do we talk about adolescent mental health and not talk about the teenage pregnancies? How do we talk about just 5 things? But I think that those 5 things, that the 5 that I picked out, which are anxiety disorder, which is the most prevalent among all the mental health issues that adolescents deal with, that comes first. And that is where we have societal anxiety. That's where we have panic attacks. That's where we have generalized anxiety disorder. That's where we have OCD. That's where we have some things that they have to really deal with. Now, talking about anxiety disorder, it is something that parents often overlook. They have other things that might cause it. They have so many factors that can influence this. Almost half of mental illnesses start about the age of 14, but most of these illnesses go untreated at this phase because parents are even struggling to deal with the basic developmental phases, the basic developments of the adolescent, that that parents are not sure when this is a problem or when this is just them being a teenager. So we have a lot of mental health issues not being taken care of, not being treated, not being diagnosed, not being treated, and just assumed to be something else. And then it keeps getting worse. Then we have the mood disorders. Depression is big among teenagers, adolescents. The rate of depression among adolescents is unhealthy, but it is what it is. They deal with a lot of mood disorders. We have the depression itself, and then with depression, I put the suicide with it. A lot of teenagers struggling with different things. And some of the things they struggle with that we don't pay attention to is even what's happening with parents. Parents don't think that when there's job loss, when there's relocation, when the kids are having issues in school, maybe being bullied, maybe they're not able to, they don't have what other kids have. They have different things affecting them, and they have this pain, the burden that they're carrying. But parents miss it. Parents see attitude. Parents see, okay, you now want to tell me that you're old enough and you want to prove yourself, and the response is just not therapeutic for adolescents. So they're carrying the burden and they choose to, maybe start expressing their hurt or relieving themselves of the pain by cutting themselves. So you see a lot of adolescents wearing all this long sleeve clothes to cover up things. Now, I'm not saying every adolescent wearing long sleeve that they're covering something up, but it is one of the issues. It is one of the things that is happening. They'll have enough time if they do three things. What's it? They'll have enough time if they exit Snapchat, Instagram, and TikTok. Okay, just like you better be running away because they're coming to get you. They are coming to get you. Like, what did you say? You take a teenager's adolescent phone away from them, or you tell them to leave all this. No, like no, daddy, we're not going there. I'm sure a lot of parents agree with you, but that is the influence of, and I will come to the social media thing shortly. So as they're dealing with, I mentioned anxiety disorders, mood disorders, where we have bipolar disorder, depression, and I attach suicide to that. It's got to be addressed. Parents need to know what are the red flags? What is it that we should be looking out for? Now, another one is eating disorders. A lot of adolescents, they are not, this is a phase where there are a lot of changes going on in the body. They are physically developing, they're intellectually developing, they're emotionally developing, and they really can't balance. It's too much going on for them. And a lot of times, the physical development is faster than the intellectual development. So people are seeing the body, they're seeing how big they are, you're seeing how developed their sexual organs are, and there's a kind of expectation that people have of them that their intellect is not quite catching up with. For them, at the early adolescent phase, they're still so concrete. Things are either black or white, right or wrong, disgusting or nice, cool or ugly. It is one of those two things. They don't have the ability to be abstract yet. The part of their brain that deals with executive functions, it's not quite developed yet. So everything, their reaction is just based on, it's just emotions. They just go bam, bam, bam. So you see violence is very common, and they react, so they take things so personally. They are quick to respond. They can just go AWire anytime because they are not quite thoughtful or abstract or planning for the future. They're just about now and here, and they react like that. So with those three things, the anxiety, the mood disorder, then eating disorder coming as a result of wanting to fit in, wanting to look good, wanting to be slim, when they have acne all over, and that's a problem. When they are getting too big and they are shamed, where their friends are making fun of them and they don't like it, when they're seeing images on social media and they want to look like that, when social influencers are dictating or kind of influencing what they think perfect body image is, and they're trying to be like that. So they start having either the restrictive eating disorder or the excessive eating disorder to cope with all the stresses. Parents also need to be aware of this and at least not know just for you to be scared of it or be looking out for it, but at least have the knowledge so that you're able to either prevent, protect them for some things, or to be able to support them when things arise in in good time, and not delay diagnosis or not delay support or not delay help or not push them away. Now, another one is the substance use. This is now so crazy, I'll tell you. Just yesterday, I was reading in the news that a school district, the parent is going to the school to find out why a cookie in school was laced with, the cookie that her child got in school was laced with a kind of drug, psychoactive substance, and it got the child in trouble. Now, this is everywhere. Teenagers are vaping, teenagers are drinking, teenagers are smoking, teenagers are doing all sort of things in the name of fitting in or in the name of just being, the fear of not missing out. And they're trying not to be the odd one out, even if they know that it's not right. So all that is out there, and there are more. If I tell you, there are so many parents that are in denial that if you told them that their child, either their daughter or their son, is possibly trying out drugs or trying out alcohol, or said they would almost swear by their grave that that is not their child. But there are a lot of teenagers, a lot of adolescents out there trying all these things. And we're going to talk about why we should be aware of this and stop being in denial. We're going to talk about what is really hindering parents from talking about these things. This is also similar to sexual relationship and activities. Like when they're talking of kids getting their HPV vaccine, there's some parents who say, "No, my child is not sexually active. They don't have to be vaccinated. It's exposing them to it. I trust my children. They don't have to." See, the world has gone beyond that. It is better to just be safe. This is not that you do not believe your child or you do not trust the training or the upbringing you have, but the other factors influencing what your children are doing, what your adolescent or your teenagers are doing. So, substance misuse, substance dependency, there are many adults that are already gone far into this, and their parents would not, they don't have the slightest idea, and they would not even believe if someone told them. Adolescents need adults, they need parents to be realistic. They need them to be realistic about it. Thank you so much for talking about my constituency. I love the adolescent age. Great. Abdullah, thank you. Great. And you'll probably be on the panel because we're going to bring adolescents here. I think I should step aside on this one and let us all hear from them. I see patients, I see adolescents, struggling with mood disorders, struggling with personality disorders, struggling with suicidal ideation. They battle, like suicidal ideation, and they have marks, and they are struggling, but their parents don't understand, teachers don't understand, and it's almost like it's a big issue, and it shouldn't be scary. We should all just be informed so that we can support them, because really the world has changed. So we said these four things. Now the last one I would like to talk about will be the oppositional deviant disorder, when they just don't want to obey authority. when they have a problem with authority or any authority figure. And this comes from underlying issues that parents are not mindful of, like what they see parents doing, like the hurt, like parents not paying attention to their needs, like parents not really taking responsibility and wanting them to commit to responsibility on their own part. So they're resisting. So they want to be on their own. They're trying to figure things out, and parents are like in their face. Adults are like in their face. Principals, teachers, uncles and aunties, dads and moms, everyone is doing their thing, but you want them to comply with what you're doing. However, you're not paying attention to other issues they're going through. So we have this being a big issue as well. And I was still struggling. Do we take oppositional deviant disorder? And where do we put attention deficit disorder, which a lot of adolescents are struggling with as well? Their attention span is so short. And like Jezba said if they would just get off their phones, off social media, and pay more attention to other things. Well, God help us with that. It is really tough because it's almost like that is their community. Now, solution. How do we move forward? We'll pick these 5 things: mood disorders, anxiety disorder, substance dependency, substance misuse, and then we'll take eating disorder and oppositional deviant disorder and ADHD. We take these 5, we'll cluster them together so that we at least touch something and raise awareness about these issues for adolescents. But where can this intervention be done? Where are the pillars? Where are the fertile ground that we can explore, that we can use, that we can plant stuff to help kids, to help adolescents? I'm sorry, I didn't call them kids. To help adolescents, to help teenagers. There are 5 major places: in the homes, parents, what's going on, your relationship with your spouse, they're seeing it, the tussle, they're seeing the financial struggle, they're seeing the stress that you have, they know that you're not around, they need you, you are emotionally absent, you are physically absent, you are shielding them away from things that they're finding they're finding out on their own. They're dealing with trust, like you don't trust them enough to tell them some things. They find out, they become resentful. The home is where everything starts from. It's like a lot of parents are expecting so much, they're forgetting, or maybe they're comparing their own adolescents to this current day Gen Z adolescents, and thinking things will be the same. Parents are not quite adapting and adjusting to what's going on. And the other place is school. We need schools to have appropriate mental health support for adolescents. A lot of bullying, a lot of physical abuse, even amongst those who are dating themselves, among those who are in relationship. You will be surprised that then the statistic that I saw is that 1 in 3 of every adolescent in an intimate relationship, they're actually going through physical abuse, emotional abuse, from their partner. This is just boyfriends and girlfriends, and they would not come home to say, "Dad, Mom, my boyfriend hit me," or they'd rather lie about it because it's like awkward, but it's happening. So the school system needs, you know a lot of schools in many countries are doing something, but I think we need to be more aware and be intentional about mental health support, school-based mental health support programs, so that adolescents have an outlet, so that they have a safe space in school, and so that things are adjusted and modified. Their lectures, the timing, the workload they have in school, the demands that they have in school, the pressure that they have in school, the bullying that is going on in school, the excesses in school, so that the school based preventive programs can be more appropriate for the culture, for the setting, and for whatever is going on in that environment and in the social media climate. Another place is yeah, where's the other place now? The other place is the healthcare system. Yes, we need more healthcare professionals that specialize in dealing with adolescent. Adolescent can they can drive you nuts. They can push you to the wall because this is the age where they push the limits. So even for the healthcare, even in the healthcare system, it is not every hospital, it is not every provider that can relate or that has the patient or that has the what it takes to really engage and find out what is happening to our adolescents. So we need the healthcare system as well to start putting measures in place. Maybe when they go for their physicals, are we doing the depression screening, anxiety screening, giving them safe space, creating an environment that is friendly to adolescents and not treat them like adults, or when they come, we're not treating them like children. So we need that balance in the healthcare system as well. The fourth place is social media. Oh Lord. Social media rules the world. Their world is social media. Social media, what the trend defines what they do. Social media trend is what they know. That is what they do. That is where they meet. That is where they mingle. Measures have to be put in place as parents, schools, the healthcare system are planning stuff. We cannot plan it in isolation. We cannot ignore the power of social media in this group of people. And if that is where you can reach them, if that is where they are, then we have to leverage on that. Taking it away from them, it's not going to be easy. Taking it away from them is not likely to happen soon. As a matter of fact, I'm thinking in the next 2, 3 years, we're going to have other more I'm trying to be cautious about using the word addictive social media platforms, but we're going to have more adolescent friendly apps that would even take more time. So we might have to start engaging them on social media to get some things across to them and not want to take it away. How can we leverage social media to meet the adolescents and pass the message across and support them? Because right now, most of the things they're seeing are not healthy. The way they should look, how they filter to look good, how what you should do, how you should dress, how you should speak, the number of likes they want, the number of, the validation they need from social media is so it, it I don't know, it's a part of them right now that we can't take it away. What we need to do is to leverage. That is what we need to do, leverage. And the fourth space is just themselves. We need to support them because really there's some of them that have mental illnesses that is there. They are behaving the way they're behaving because they actually have a mental illness. They have a diagnosable illness that parents are ignoring. So you're seeing them as being rude, or you're thinking they're sleeping too much. Adolescents like to sleep in weekends. It's almost like it's weekend. I'm not going to school, so I can be in bed till whenever I want to be. And you ask them to do something else, and you're thinking, oh, this is unusual, and we have these demands on them. When there's a change, parents are not picking up on could something else be wrong. They're thinking now it is peer pressure, it is bad influence. I told you to stop moving with these people and you're moving with them. But it might be that this child actually have maybe a personality disorder, a mood disorder, or they are still struggling with something in school. So some of them are actually sick. Some of them are actually ill. But Parents do not want to admit that it is just a teenage phase. All teenagers are terrible. All teenagers are this and that. So if we leverage on these five things, the home state, the home environment, school environment, social media, and we help them, we support them, and the healthcare system would also be more specific and will be intentional about how they're dealing with adolescent, it will help us a lot. And like I said, this is just the introductory phase. This is just the introductory uh, um, episode. Next week, the next 3 Saturdays, we're going to have adolescents coming here to talk about their own issues, make us understand what is going on. We're going to have a mental health experts that specializes in mood disorders, suicide, coming to talk to us about what are the red flags, what should we look out for, and how can we support our adolescents' mental health. And then we're going to have those who would, we're going to have the tips. So if you have an adolescent on Facebook, which God knows, there's not a lot of them on Facebook. They do not even like to be identified with Facebook. Like, what did you say? Facebook? Well, if you can get them to come, even if you have any one of your adolescents that is, maybe like a youth leader or have a project they're doing on mental health or that is really involved in any kind of project and would like to share something with us, please, we're very open to that. Already we're talking to adolescents that will come and talk to us, but if you know someone that, hey, this adolescent is doing this might be a way of giving them a voice. This platform can give them a voice. This platform can give them everybody's ears that they need to pass the message across. So please do not hesitate to send me a message and let us have them on board to talk about this. Adolescents' mental health is crucial. It is not just their business. This is something that a lot of parents are struggling with. And the more we know, the more knowledge will empower us. Knowledge will give us what we need to support them. And by that, we're protecting their future. Yeah, I'm sounding like a motivational speaker now. So, okay. So, please, the next 3 Saturdays is going to be awesome. I do not want you to miss it. I want you to plan to join us live. I want you to plan to be here. I want you to plan to say something. Tell us what you're seeing around you. Let us know what is going on, and we'll go from there. So, well, to everyone who joined, thank you so much. To everyone who made comments, thank you. To everyone who watched the replay, thank you. And drop a comment. Let me know what you think about adolescent mental health. Is there another system or group or place that you think addressing adolescent mental health there would be of significant help to the overall adolescent world's mental health? Let us know. So drop a comment, say hello to me, say hi, say something, and I'll see you next week. Okay? I'm out of here, and I will see you next week. We're about this series is going to be fun. It's going to be interesting. And do not run away. Why are you running? Don't run anywhere. I'll see you next week. Okay? Bye.